Assalamu alaikum beta. Uh, in this video lecture, I will deliver the lecture on bacterial infections of the skin, part 2. I delivered a few bacterial infections in part 1 of the video, and this is the part 2 of the video. And I remember 5 bacterial infections of the skin in the part 1 video. And here we start with the skin bacterial infection number 6. It has two different terms, cellulitis and erysipelas. Cellulitis and erysipelas. By the way, these are the bacterial infections and inflammation, okay, of skin in general. Cellulitis or erysipelas, this is the bacterial infection and ultimately inflammation of skin. But what's the difference between cellulitis and erysipelas? Beta, if the infection and inflammation is limited to subcutaneous tissue, then it is called cellulitis. And if it is involving dermis and upper subcutaneous tissue, then it is called erysipelas. I have told you in many videos. Again, let me tell you the basic anatomy. This is the epidermis at top. Okay, below epidermis is this nice little dermis, and below dermis is this subcutaneous tissue. Okay, if the infection is restricted here in the subcutaneous tissue, then it is called cellulitis. And if the infection is involving dermis and upper part of the subcutaneous tissue, then it is called erysipelas. Okay. So this is the bacterial skin infection and ultimately inflammation. Yeah, and you now better know the difference. What is the causative agent which produces the infection? It is most commonly group A streptococci, and it may be Staph aureus. It may be Staph aureus, but most commonly it is group A streptococci, right? Okay, what are the predisposing factors that predispose you to develop these infections? Some conditions like diabetes mellitus. So this diabetes mellitus is the condition in which you are predisposed, you are at high risk of developing this bacterial infection. Or immunosuppression in case of HIV, in case of transplant, in case of whatever immunosuppression, due to whatever reason you have immunosuppression, you are at risk of developing this skin infection of the bacteria. And ear infection by group A streptococci. Firstly, you develop infection in the ear by this bacteria, and the same bacteria later involves your skin and produces cellulitis and may produce erysipelas. Okay, tinea pedis. I am not going to tell you about tinea pedis because I have told you everything about this tinea pedis in the lecture of fungal infections. Okay, so tinea pedis is, by the way, the fungal infection of the foot. And now you can please beta let me know in the comment section or wherever you want to let me know. Just let me know that what type of tinea pedis is associated with bacterial infections leading to cellulitis and erysipelas. Do let me know beta. It is very important. If you do know, that's a good news for you. Okay, and varicose eczema. If I am suffering from varicose eczema, it is one of the types of eczema. इसको हम gravitational eczema भी कहते हैं. जब अब eczema का lecture deliver करूँगा तो उसमें बताऊँगा ये क्या होता है. तो बेटा अगर किसी को lower limb में varicose eczema है, lower leg में, तो बहुत मुमकिन है कि वो इंडिविजुअल जो है ग्रुप ए स्ट्रेप्टोकोकाई का इन्फेक्शन डेवलप कर ले, या सेल्यूलाइटिस या एराइसिप्लास. ओके, सो फार व्हाट डिड वी लर्न? That this is the infection and ultimately inflammation of the skin, and if it is involving the subcutaneous tissue only, then it is called cellulitis, and if it is involving subcutaneous tissue upper part and dermis, and then it is called erysipelas. Okay, a कौन है bacteria? Group A streptococci, or less often Staph aureus. What predisposed you to develop these infection? Okay, I'm somebody like I'm somebody what should be there in my body to develop this nasty infection? I can have ear infection with group A streptococci. Okay, I may be immunocompromised. I may have diabetes mellitus. I may be suffering from varicose eczema or tinea pedis. These are the things that can predispose you to develop this bacterial infection. Okay, so बेटा एक बार अगर ये इन्फेक्शन हो जाए स्किन में, अगर सेल्यूलाइटिस है तो सबक्यूटेनियस टिश्यू में, और अगर एराइसिप्लास है तो डर्मिस सबक्यूटेनियस टिश्यू के अपर पार्ट में, तो क्या लयन बनते हैं स्किन पे मैं आपको बताता हूँ. स्किन पे क्या लयन प्रोड्यूस होता है. यू कैन सी इन द स्लाइड हेयर. Yeah, the lion is unilateral, that is on single side, one side. The lion is very much hot. Oh, that means very much. That's very much warmness in the lion. Okay, lion is painful, by the way. Okay, it is completely erythematous and edematous. Sometimes you come to see some blisters over the erythema, and it may be hemorrhagic, that it may be bleeding. Okay, yeah. Now let me first show you this entire thing. Okay, quickly. Yeah, there we go beta with this picture. Okay, let me just focus on cellulitis first. Okay, this is unilateral. It is involving only single limb. Obviously another limb is not shown here, but you just trust me that it involves only a single limb. This is going to be very much warm, very much hot, gives feeling to the patient. It is painful. Okay, isn't it erythematous? It is erythematous. Isn't it edematous? Can't you see some swelling in this? Okay, it is edematous, but I hope you cannot see some blisters in this picture, because blisters do not appear more often, they appear less often. Okay, and it may be later hemorrhaging, may blood come out of the it, right? So this is cellulitis beta. This is cellulitis, and same is in case of erysipelas. Same is in case of erysipelas. It is unilateral. It is hot. It is painful. Isn't it erythematous? It is erythematous. Very much red. Isn't it edematous? It is edematous. It may have blisters, but less often. It may be hemorrhagic. If both cellulitis and erysipelas are having same features, that means it is hot, it is painful, it is warmth, it is having warmth, and it is erythematous, it is edematous, it may hemorrhage out. Then how the heck are you going to differentiate between these two? By just looking at the lesion, you can't say na it is involving, okay, subcutaneous tissue, so it is cellulitis. It is involving the dermis and upper subcutaneous tissue, so it is erysipelas. You can't see it from the lesion, na? Then how the heck you come to know it is cellulitis or erysipelas? But by just looking at the lesion. Both are erythematous, both are edematous, both are painful, both are hot. How will you make the diagnosis? It's very clear from the picture, you can see. The lesion in case of cellulitis is having ill-defined borders. The borders are not very much defined. If I zoom in the picture, can you see the borders are not very much defined? Borders are rough. But you see in case of erysipelas, the lesion is very much having well-defined margins. Okay, so this is the difference beta you have to keep in your mind. Right. With all these features, patient develop some constitutional symptoms also, like fever. Okay, malaise means feeling of not being well. Okay, leukocytosis if you do CBC, and रीजनल lymphadenopathy. इस रीजन के जो lymph nodes होते हैं उनकी इन्फ्लेमेशन हो जाती है, सूजिश हो जाती है उनमें. एज आई मैंशनड, अगर सेल्यूलाइटिस है तो लेजन की जो मार्जिन्स होंगी वो इल डिफाइंड एजेस होंगी, मार्जिन्स होंगी, और अगर एराइसिप्लास है यू कैन सी द मार्जिन्स आर well defined. Okay, so yeah, this is all about cellulitis and erysipelas. Let's just have a look at the diagnosis part. कैसे आप diagnosis confirm करेंगे कि ये erysipelas erysipelas या cellulitis है? So you have couple of ways to go. Number one, serology. आप देखेंगे ब्लड सीरम में आपको बैक्टीरिया मिलता है, नहीं मिलता? बैक्टीरिया मिलता है मोस्टली ब्लड सीरम में. ग्रुप ए स्ट्रेप्टोकोकाई. So serology is always positive in case of cellulitis, erysipelas. And जिस जगह पे लेयन है वहाँ से जब आप स्वाब लेते हैं स्किन को स्क्रैप करके, तो यहाँ पे कल्चर नेगेटिव आता है, यहाँ पे बैक्टीरिया नहीं मिलता। इन्फेक्शन बिल्कुल यहाँ पर है अर्ली स्टेजेस में, लेकिन बैक्टीरिया यहाँ से फिर ब्लड में स्टीम आउट कर जाता है, ब्लड में निकल जाता है। तो ब्लड में तो आपको बैक्टीरिया मिलता है, सीरोलॉजी पॉजिटिव आती है, लेकिन इस जगह का जब आप कल्चर करेंगे, इस यहाँ की स्किन का स्वाब लेके उसका कल्चर करेंगे, तो यहाँ पे आपको बैक्टीरिया नेगेटिव मिलेगा। ठीक है, okay. And what is the treatment plan? In mild cases you need to, because this is the bacterial infection, so you need to give oral antibiotics, and in severe cases you have to shift from oral antibiotics to IV antibiotic, especially IV flucloxacillin. फ्लूक्लोक्सासिलिन के साथ एक और IV एंटीबायोटिक ऐड करेंगे, या क्लेरिथ्रोमाइसिन या क्लिंडामाइसिन या वैंकोमाइसिन। ठीक है, सो दिस इज इट बेटा। अच्छा, अगर आप इसको ट्रीट ना करें सेल्यूलाइटिस और एराइसीप्लास को, तो इसकी कॉम्प्लिकेशंस क्या हो सकती हैं बेटा? सबसे पहले लिम्फेडीमा, दैट इज़ इन्फ्लेमेशन एंड एडीमा, दिस इज इन्फ्लेमेशन एंड स्वेलिंग ऑफ द लिम्फेटिक वेजल्स। ओके, और जो आपका ब्रेन में ये ड्यूरल साइनस होता है, कैवर्नस साइनस, उन ब्लड वेजल्स में थ्रोम्बस का बनना, अगर आप इस कंडीशन को ट्रीट नहीं करते तो लिम्फेडिमा होगा, लिम्फेटिक, दैट मीन्स लिम्फेटिक वेजल्स की स्वेलिंग और उनकी इन्फ्लेमेशन होगी। दूसरी क्या कॉम्प्लिकेशन है? कैवर्नस साइनस में थ्रोम्बस का बनना। और उसके अलावा बेटा सेप्सिस हो सकती है, अगर ये बैक्टीरिया वाइड स्प्रेड फैल जाए ब्लड में बहुत ज़्यादा और मल्टी ऑर्गन इन्वॉल्वमेंट करने लगे। Glomerulonephritis, you all know this very much, I hope. This is the obviously nasty condition in the kidney nephrons and inflammation there. Okay, so beta, this is all about cellulitis and erysipelas. Hope you are clear with this. Yeah, after this cellulitis and erysipelas, at number 7 you have another very important condition, another bacterial infection of skin, that is erythema. Erythema is the obviously it is a bacterial infection of the skin. It is mild, chronic, localized, superficial skin infection caused by a bacteria, Corynebacterium minutissimum. Okay, it is, by the way, a part of normal skin flora. This nice little baby, Corynebacterium minutissimum, this bacteria actually lives in your skin. This is the part of your normal skin flora. Then you must be thinking, a question must be striking in your mind, that if this nice little baby is living in your skin, then how the heck is this going to produce infection? That chronic, localized, superficial skin infection, how the heck is this possible? How is this infection possible if this is living into your skin as a normal flora? There must be some predisposing factors, na? There must be some factors, triggering factors, predisposing factors that actually triggers this bacteria. Despite of living into your skin, it keeps on infecting you. So what are the predisposing factors? Very much warmth and humidity. ज़्यादा ह्यूमिडिटी और ज़्यादा वार्मथ का होना आपकी इन्वायरमेंट में, आपकी स्किन पे। ठीक है, तो इन्हीं कंडीशंस में ये बैक्टीरिया, बीइंग अ नॉर्मल फ्लोरा ऑफ योर स्किन, इट इन्फेक्ट्स योर स्किन। ओके, अच्छा, इसके इन्फेक्शन से क्या होता है? वैसे तो मोस्टली एसिम्प्टोमेटिक होता है, लेकिन कुछ केसेस में स्किन पे ये लेयन बन सकता है। क्या लेयन बन सकता है? माइल्ड, इची, वेल डिफाइंड रेड, ब्राउन एंड स्केली लेयन इन द फ्लेक्सर्स एंड द टो क्लेफ्ट्स। मैं आपको ये बातें कंफर्म कराता हूँ, देखें ज़रा यहाँ से। It is itchy. Obviously, I can't show itchiness in this picture. Itchiness is feeling. I can't show this, obviously. So it is mild itchy. It is well defined. Obviously, it's well defined. You can see this is well defined with real nice margins. It is red brown, probably, if I'm not wrong. And it's a scaly lesion. There are some scales if you zoom in, and you can see some scaling down there, right? And where is this lesion found in skin? You can see this is in flexures. Flexural surfaces like axilla, and it can be seen in the toe clefts. Okay, yeah. And then, okay, later is investigation. How do you investigate it? Well, you don't need to go towards this all procedure. You just look at the lesion and you can diagnose it. Okay, it is erythema. But okay, you can take skin scrapings from here. You can just take the skin scrape from here, and you can take this skin scraping to wood slide, microscopy or culture, any of the three procedures. Okay, on microscopy you will come to see bacteria on culture. You will come to see the bacteria. If bacteria is there, then you say, okay, it is erythrasma. Yeah, if Corynebacterium minutissimum is the bacteria now, which is producing this infection. So you take the skin scraping, take it to the microscope, or perform the culture of the skin scraping. If you see this bacteria, then obviously it is erythrasma. Or you can take this skin scraping to wood slide as well. And if on wood slide, this skin scraping, this sample shows coral pink fluorescence, then obviously there is the bacteria called Corynebacterium minutissimum. Okay, so this is the lion. Just take some scrapings from here, take it to the microscope. Can you see the bacteria? If you can see the bacteria, it is erythrasma. If you cannot see Corynebacterium minutissimum, obviously this is not erythrasma. You culture the skin scraping. If you see this bacteria, it is erythrasma. If you do not, it is not. You take the sample to wood slide. If you can see coral pink fluorescence, then obviously it is going to be Corynebacterium minutissimum. If you can't see this nice little fluorescence, there is no such bacteria. Okay, so this is how you confirm this erythrasma. And the treatment plan is going to be, obviously it is a bacterial infection, so antibiotics will be used. Antibiotic like fecidic acid. आपको पता है fecidic acid के साथ हम और क्या देते हैं मिला के? टॉपिकल एजोल, जैसे क्लोट्रामाजोल और मिकोनाजोल. आप कहेंगे सर ये तो बैक्टीरियल इन्फेक्शन है, तो इसमें ये आपने एंटीबायोटिक दी fecidic acid, ये तो समझ आता है, लेकिन वाई दिस एंटी फंगल ड्रग हेयर? बिकॉज बेटा दिस लायन इज ससेप्टेबल टू डेवलप फंगल इन्फेक्शन. इसमें बहुत चांस होता है ऊपर से फंगस भी ग्रो कर जाता है. इस वजह से हम प्रोफाइलेक्टिकली fecidic acid भी देते हैं. क्यों? क्योंकि बिकॉज फंगल को इन्फेक्शन इज कॉमन. ठीक है, अगर इससे ट्रीट नहीं हो पाता, डिजीज़ बहुत रेजिस्टेंट है, तो फिर हम शिफ्ट करते हैं पेशेंट को दूसरी एंटीबायोटिक पे, दैट इज़ ओरल एरिथ्रोमाइसिन. ठीक है, और साथ में हम एंटीसेप्टिक्स लगाते हैं ताकि डिजीज रिकरेंस ना हो, बार बार रिपीट ना हो. ठीक है, सो दिस वाज ऑल अबाउट बेटा एरिथ्रेस्मा. एंड आफ्टर एरिथ्रेस्मा इज अनदर बैक्टीरियल इन्फेक्शन. या इट इज केराटोलिसिस. लेट मी टेल यू, लेट मी शो यू. या this is pitted keratolysis, another bacterial infection. I must mention beta, everything in this lecture is from your textbook Davidson. If you don't even open the book after having this lecture, don't worry about the textbook. Okay, you are going to cover everything from here. Okay, you just have to trust me and you just keep on following this. It's going to be very much worthy. You now see a bacterial infection number 8. It is pitted keratolysis. It's again a skin infection of the bacteria, very much superficial. Who is the bacteria here? Again, the same bacteria as we did in erythrasma. It is Corynebacterium. Most commonly Corynebacterium, and sometimes Streptomyces species may be there causing pitted keratolysis. Okay, if this bacteria has infected your skin, what's going to happen with your skin? What lesion will appear on your skin? Pits will appear on the sole of the foot. स्किन में एरोजन्स हो जाएंगे, छोटे छोटे होल हो जाएंगे, छोटे छोटे पिट्स बन जाएंगे पैर के सोल में. ठीक है, जस्ट लाइक दिस. कैन यू सी छोटे छोटे एरोजन्स? कैन यू सी छोटे छोटे होल्स? कैन यू सी पिट्स? दीज आर द पिट्स ना, दीज आर द एरोजन्स. ओके, ऑन द सोल. By the way, by the mercy of Almighty, this is asymptomatic. It could be painful and it could be very much painful, but it is asymptomatic. Okay. What is the predisposing factor that lead you to develop this bacterial infection? हाइपरहाइड्रोसिस, ज़्यादा स्वेटिंग का होना, खास करके पैरों में. तो इसके लिए आपको ओपन फुटवेयर यूज़ करना चाहिए और कोशिश करनी चाहिए कि कम से कम पैरों में पसीना आए ताकि ये इन्फेक्शन ग्रो ना हो बैक्टीरिया का और पिटेड केराटोलिसिस ना हो. ठीक है, इन्वेस्टिगेशन और ट्रीटमेंट प्लान वैसा ये बिल्कुल जैसा एरिथ्रेस्मा का था, यही एंटीबायोटिक प्लान हम मैनेजमेंट के लिए यूज़ करते हैं. ठीक है बेटा. ओके, आफ्टर पिटेड केराटोलिसिस, फ्यू वर्ड्स अबाउट द माइकोबैक्टीरियल इन्फेक्शन. Few words about mycobacterial infection. By the way, mycobacterial infections is a lengthiest topic. It should be a detailed separate topic. Okay, but we can have few words here. Okay, to just meet your curriculum. Mycobacterial infections like Mycobacterium, it can be lepra, it can be Mycobacterium TB or some other mycobacterial infections. Mycobacterium lepra, my son, it causes leprosy. You are familiar to this, I hope. You have done this from your infectious microbiology, if I'm not wrong. Mycobacterium lepra produces condition called leprosy. It's of two types. One is the tuberculoid leprosy. It is also called paucibacillary leprosy. Pauci means less, few. Okay, that means few bacteria or less bacterial load is there. Okay, and high immune activation. ठीक है, अगर आपकी इम्यून एक्टिवेशन ज़्यादा हो और नंबर ऑफ बैक्टीरिया कम हो तो दैट इज़ ट्यूबरकुलोइड लेप्रोसी और पॉसीबैसिलरी लेप्रोसी. ठीक है, और अगर आपकी जो इम्यून एक्टिवेशन है बेटा वो कम हो, अगर इम्यून एक्टिवेशन कम हो और बैक्टीरियल लोड ज़्यादा हो तो then it is called lepromatous leprosy or multibacillary leprosy. Okay, let's suppose you have developed any of two, either you have developed, let's suppose, tuberculoid leprosy or lepromatous leprosy. The generalized pattern of lesion that appears on your skin is going to be ज़ाहिर है बेटा ये स्किन इन्फेक्शन है लेप्रोसी. लेप्रोसी अगर होगा तो स्किन पे क्या मैनिफेस्टेशंस आएंगी बेटा? You come to see hypopigmented or erythematous patches or nodules with altered or loss of sensation. Okay, I'll try to show you this lesion. Okay, can you see in this picture? Yeah, can you see in this picture? Okay, these two are the lesion which I have to show you. This and this nice little. What did I say? It may be hypopigmented or erythematous. This is red one, so it is more erythematous. It is not really reddish, it is hypopigmented. It is hypopigmented, and this one is erythematous. Okay, so hypopigmented or erythematous, this is patch by the way, or if it is little elevated then it will be nodule. एंड यहाँ पे जो सेंसरी है, सेंसरी सप्लाई है वो लॉस हो जाता है. सो देर इज लॉस ऑफ सेंसेशन इन दिस रीजन एंड स्किन इज थिक बाय द वे इन दैट रीजन. ओके, दैट्स माइकोबैक्टीरियम लेप्रा. अगेन आई रिपीट, दिस इज अ बिट लेंथियर टॉपिक. माइकोबैक्टीरियम लेप्रा, इट्स अ कंप्लीट डिटेल्ड टॉपिक. सो हियर आई हैव टू कवर इट जस्ट ऑफ skin aspect. After mycobacterium lepra is mycobacterium tuberculosis. Obviously हम इसकी जो पल्मोनरी इन्फेक्शन होता है वो तो यहाँ पे डिस्कस नहीं करेंगे क्योंकि डर्माटोलॉजी है. तो एक्स्ट्रा पल्मोनरी स्किन इन्वॉल्वमेंट बेटा, इट कॉज रेड ब्राउन स्कैरिंग ऑन द स्किन एंड इन्फ्लामेटरी प्लेक्स. ओके, रेड ब्राउन स्कैरिंग एंड इन्फ्लामेटरी प्लेक्स ऑन द स्किन. और उसके अलावा ये होता है बेटा, माइकोबैक्टीरियम ट्यूबरकुलोसिस की वजह से स्किन पे होता है सक्रोफ्लोडिमा. Scleroderma, that is skin changes overlying lymph nodes or joints infected with TB. ओके, मोस्टली क्या होता है बेटा, मैं यहाँ पे थोड़ा समझाने की कोशिश करूँ कि लेट सपोज ये एक लिम्फ नोड है. दिस इज़ अ नाइस लिटिल लिम्फ नोड. दिस इज़ वेरी मच सैड and you people know why this lymph node is very much sad. This is lymph node by the way, and this lymph node is very much sad. Why it is sad? Because it is infected by Mycobacterium tuberculosis. Okay, and this is the skin. Okay, just above the lymph node. Okay, so the lesion which will appear here on the skin, which is just over the lymph node, that lesion on the skin is called scrophulodema. Okay, so what have I written here? Scrophulodema is the skin changes overlying lymph nodes or joints infected with TB. This was the lymph node infected with TB, और जो स्किन के ऊपर चेंजेस आते हैं उनको हम स्क्रोफ्लोडिमा कहते हैं. ज़रूर नहीं है lymph node, ये जॉइंट भी हो सकता है which is actually infected by TB. ओके, और उसकी जो ओवरलाइंग स्किन होगी बेटा, उसमें जो चेंजेस आएंगे, जो इन्फ्लेमेटरी प्लेक्स बनेंगे, स्कैरिंग होगी, उसको स्क्रोफ्लोडिमा कहते हैं. ठीक है, तो माइकोबैक्टीरियम लेप्रा और टीबी के अलावा बेटा अदर माइकोबैक्टीरियल स्किन इन्फेक्शंस, फॉर एग्जांपल माइकोबैक्टीरियम मेरिनियम. It is most commonly occurring in those people who clean tropical fish tanks. Okay, so beta, that's all about the mycobacterial infections and the entire topic cutaneous bacterial infections, right? Hope it really helped you, and that's all about the lecture. Thank you very much. Class dismissed.